It's great to be here. And yeah, so I'm Sara Rogers. I'm a pharmacist by training. I'm also a co-founder and director at the American Society of Pharmacovigilance, where we focus on medication safety and addressing the high rate of adverse drug events in the United States. I recently joined Texas A&M University to implement precision medicine in their primary care clinic. So in this role, I serve as a clinical specialist where I see patients who are on multiple medications, and I complete a comprehensive medication management, including running genetics tests to better understand how patients process medications, and then provide a tailored medication recommendations based on age, genetics, and other factors that can affect medication response. So today we're going to talk about strategies to enhance medication safety. These are all actionable things that you can do to help make informed decisions about your health and work more closely with your doctor and pharmacist to improve your care. But first, what's the problem? So let's talk about adverse drug events, which is defined as an injury resulting from a medical intervention related to a drug. So this includes medication errors and side effects for medications. A medication error is basically anything that's been done incorrectly in dispensing a drug to a patient. So it can happen at any point in the process. And it's basically 5 things that we want to get right every time we give a medication to a patient. It should be the right patient, the right drug, the right dose, the right route of administration, and the right frequency. So anything that's done incorrectly there is a medication error. Not all medication errors end up harming a patient. So maybe a mistake was made, but it doesn't cause harm to a patient. So then there wasn't an adverse drug event. The event is the actual harm to a patient from an error or from any sort of other things that can cause events. So a side effect, which is also known as an adverse drug reaction, is something that's uncomfortable, that wasn't intended, but the medication was taken correctly as prescribed, but there was still some sort of side effect or something that happened that was just uncomfortable or caused a serious issue. Adverse drug events continue to be among the top 5 common causes of death in the United States. In fact, every 2 minutes, somebody dies from an adverse drug event. The United States spent an estimated $528 billion on non-optimized medications, a number that exceeds the costs of the drugs themselves and the cost of all major diseases. And that figures from 2016, so $500 billion because of non-optimized medications. This often occurs because of the presence of various problems, including chronic diseases, acute conditions, and symptoms, which accumulate with age. Doctors use evidence-based prescribing guidelines designed for the management of single diseases, but when applied to individuals with multiple conditions, these guidelines can produce very complex drug regimens. These issues are of urgent importance in older populations, with US seniors over age 50 taking an average of 13 or more medications. In addition, it's estimated that 350,000 adverse events occur in the US nursing homes each year, and events are experienced by up to 40% of hospitalized older adults. The use of multiple medications, often referred to as polypharmacy, is common in older populations with multiple chronic diseases, since 1 or more medications may be used to treat each condition. Polypharmacy is associated with adverse outcomes, including death, falls, side effects, increased length of stay in hospital, and also readmission to the hospital soon after discharge. So it's a common cause of readmissions as well. The risk of adverse effects and harm increases with each new medication that you take. Part of the reason for this is because drugs can interact with each other. Some medicines can worsen other diseases that they're not being used to treat. And older patients are at even greater risk of adverse effects, not only if they are taking multiple medications, but also due to factors related to healthy aging, like decreased kidney and liver function, lower lean body mass, reduced hearing, vision, and mobility. So there are a lot of different factors that put older adults at risk for serious side effects for medications. And it may take, it kind of makes it more important to inspect each medication and investigate whether it's helping or harming, and if there are better alternatives. Chronic disease is a key driver leading to polypharmacy. 6 out of 10 adults in the US have a chronic disease. 4 in 10 adults in the US have 2 or more chronic diseases. While in some cases, the use of multiple medicines or polypharmacy may be clinically appropriate, it's important to identify polypharmacy that increases risk of unnecessarily of adverse events and poor health outcomes. We're starting to see a shift towards adopting the term appropriate polypharmacy to differentiate between taking many versus too many drugs, instead of kind of the simple numerical count of medications, which is often used to define polypharmacy. So for example, where I work and the research that we're doing right now, we consider 5 or more medications as polypharmacy, and a potential reason why patients get referred to the clinic here for a full medication history and work up to try to explore their medications and determine if each is appropriate, necessary, and optimized. Medicines can be really helpful in treating different diseases, but sometimes they're not necessary or used inappropriately. Another major contributor to polypharmacy is something called prescribing cascade. And that is when a new medication is started to manage a new symptom instead of identifying the underlying cause of the new symptom. So in this case, a new medicine is prescribed to treat a side effect associated with another medication, and the mistaken belief that there's a new medical condition which requires treatment. Prescribing cascades can also occur intentionally to prevent an anticipated side effect. For example, taking a proton pump inhibitor like Protonix or Prilosec preemptively to reduce any sort of GI issues associated with medicines like ibuprofen that can cause upset stomach. Prescribing cascades and using new medications to treat symptoms of other medications can obviously increase the risk of harm. Many frequently prescribed drugs have been implicated in prescribing cascades. So drugs for dementia, high blood pressure medications, sedatives, opioids, anti-epileptics, antibiotics, and medicines for nausea. So in the example here on the screen, you might start taking ibuprofen for joint pain, and ibuprofen can sometimes increase blood pressure. So maybe your doctor starts verapamil, which is used to lower blood pressure. Side effect of this type of medicine is edema or swelling. So then maybe you'd get a new prescription for a diuretic like hydrochlorothiazide to help with the swelling. Because of the way hydrochlorothiazide works, it can cause gout. So then you'd have sudden severe attacks of pain and swelling in your joints. So you might take allopurinol, which is used to treat the gout. And then allopurinol can cause hypotension or low blood pressure, which could increase your risk of falling or fainting. And if you were to fall, get a hip fracture, that could severely limit mobility and cause a lot of issues. So as you can see, many medications may be involved in prescribing cascades, and a lot of times medication side effects can go unrecognized and unreported. So there's a big potential for serious harm associated with prescribing cascades, and prescribing cascades are actually pretty common. So this just kind of highlights the need to determine if a new symptom is related to a new condition that needs treatment, or if it's a side effect from a medication, which would really just require changing or adjusting that medication. So anytime you get a new medication, it's really important to understand why your doctor is prescribing it, and ask questions to understand what it's being used for and if there are other alternatives that may be better for you. Because with any medication, there's always a risk for side effects. And that's why it's so important to take an active role in your care. It really should be a partnership between you, your doctor, and your pharmacist, as well as any other healthcare professionals that you interact with. Part of that is gathering information and making decisions about your symptoms, illness, and other potential treatment options. Patient engagement research shows that the least engaged patients are twice as likely to delay care and 3 times more likely to have an unmet medical need, and versus engaged patients. As patients become more engaged with their care, we see higher levels of preventative health behaviors and preventative care, as well as increased self-management of health conditions. So I hope after we discuss some different strategies for safe medication management today, you will feel even more empowered to take an active role in your care and kind of be at the center of that patient, provider, pharmacist triangle. So let's talk about some of the strategies for safe medication management. The first is to know your meds. I would recommend being knowledgeable about the medications you're taking. So for example, if you go to the emergency room or if you're admitted to the hospital, they'll need to know what medications you're taking at home so that you can continue taking them while you're at the hospital. A lot of medication errors that occur at the hospital are because we don't have access to an updated list of what patients are taking already when they arrive. If there's any discrepancies between the medications you take at home and what's ordered in the hospital, that can cause a lot of issues. Recent studies have shown that accurate history taking can lead to substantial reduction in medication discrepancies. There are several barriers to getting that kind of accurate medication list during transitions of care, which includes fragmentation of health systems. So each facility may have a different computer system, and they're not able to share information between systems effectively. So that's one challenge. Polypharmacy, again, drives some of these discrepancies. The more medications you take, the more likely it is that a mistake will be made during a care transition. The biggest challenge is lack of patient understanding of their medications. And that's where taking an active role in your healthcare and knowing your meds can make a big difference. So at the very least, you should be able to tell a doctor what medications you take, their strength, and when you take them. I would recommend creating a current medication list and updating it regularly. There are different websites and apps that have free medication forms. There's tools like My Medications, Med Tracker, or CareZone Meds, which can help you manage your medications and provide you with a format so you know what to include. The template here is from a website called Aging with Stride. And even if you already have a medication list, there are some things that you should include on the list that are oftentimes left off, but that can be really important. So for example, allergies to medications and what type of reaction you have when you take them. Sometimes people may list medication allergies that aren't true allergies. So in terms of being allergic to a medicine, we think of things like rash, hives, throat swelling, some sort of kind of, allergic reaction versus a side effect. And it's important to distinguish, because if you're allergic to a medication, you shouldn't take it because of that type of reaction. If you have a side effect, it may still be a good med in the short term. So that's why it's important to kind of only report on this allergy section the true allergies, if you will. Name of your medication, including if it's an extended release dosage form. So if it has an XL, an XR, or an ER at the end of that drug name, that's an extended release dosage form. And that affects how often you take it and how it works. So a common medication that people might take is metoprolol for high blood pressure, which comes in extended release form. So, and it makes a big difference which one, whether it's the immediate release or the extended release. So that's something you want to note on your med list. Dosage, instructions for taking the medication, and how long you've been taking the medication, when you started it, when it was stopped, and the reason why you stopped taking it. Also want to identify the doctor who prescribed the medication and their phone number so they can be contacted with any questions. If you could also include the pharmacy name and phone number where you pick up your medications. That way, again, if there are any questions, we could check with the pharmacy to make sure there's not any discrepancies. Note section is good. You may want to include if you're supposed to take it with or without food, or if you take it at a certain time of day, or any other important information. And also remember to include any vitamins, herbal supplements, investigational drugs, or sample medications from a doctor, or any borrowed medications that you use along with your prescribed medications. These could cause an interaction or negative side effects that your physician needs to be aware of. In order to provide the best possible care, it's important that your care provider knows everything you're currently taking or have tried in the past. For most current for the most current information, you may want to update your list every time you visit the doctor or go to the pharmacy, and make sure that any caretakers have the most recent copy of your list so they can check for any relevant information that could affect your treatment plan. Since emergencies can strike at any time, it's crucial to keep a copy of your medication list with you. You can carry a copy of your form in your purse or your wallet to be sure you have it with you at all times. Another more space-conscious option is to use an app on your phone. So paramedics usually check your phone for emergency contact, and they might see the app. So you may also want to consider having an ICE, or in case of emergency contact that does have a copy of your medication list, since that would be the first person that the hospital contacts. Since taking the wrong dose or the wrong medication can be harmful, it's important to make sure you know for sure which pill you're taking. If you need to verify which pill you're looking at, you can use a pill identifier tool. So this example is from drugs.com, but there are several different options. You basically, all you have to do is fill out the form here. So you can fill in any letters or numbers that are imprinted on the pill, as well as the shape and color to help determine which pill it is. As a general rule, periodically check your medicine cabinets for expired, rebottled, or unidentified pills. To avoid confusions and mistakes, keep all medications in their original bottles or packets with pertinent labeling and instructions attached. If you can't identify which pill it is, you don't find a match on the pill identifier, you could also contact your pharmacist to help. Strategy number 2 is know your genes. This is a more advanced strategy, but one that's gaining a lot of momentum. And we now have an ability to leverage genetic information to help guide medication therapy. Pharmacogenomics is an important example of the field of precision medicine, which aims to tailor medical treatment to each person. Pharmacogenomics looks at how your DNA affects the way you respond to drugs. In some cases, your DNA can affect whether you have a bad reaction to a drug or whether a drug helps you or has no effect. Pharmacogenomics can improve your health by helping you know ahead of time whether a drug is likely to benefit you and be safe for you to take. Knowing this information can help your doctor find a medicine that will work best for you. Drugs interact with your body in a lot of different ways, depending both on how you take the drug and where the drug acts in your body. So after you take a drug, your body needs to break it down and get it to the intended area. Your DNA can affect multiple steps in this process to influence how you respond to the drug. Some examples of these interactions include drug receptors. Some drugs need to attach to proteins on the surface of cells, and your receptors, in order to work properly, your DNA determines what type of receptors you have, how many, which can affect your response to the drug. You might need a higher or lower amount of the drug than most people, or a different drug. Drug uptake, some drugs need to be actively taken into the tissues and cells in order to work. your DNA can affect uptake of certain drugs. Decreased uptake can mean that the drug does not work well and can cause it to build up in other parts of your body, which can cause problems. Your DNA can also affect how quickly some drugs are removed from the cells where they act. If drugs are removed from the cell too quickly, they might not have time to act. So that's a reason why medications can affect people differently. Drug breakdown, your DNA can affect how quickly your body breaks down a drug. If you break the drug down more quickly than most people, your body gets rid of the drug faster and you might need more of it or a different drug. If your body breaks down the drug more slowly, you might need less of the drug. While pharmacogenomic testing is currently used for only a few drugs, the field is growing very quickly. Improved understanding of how pharmacogenomics can protect your health and improve treatment is becoming more and more important. So talk to your healthcare provider about what pharmacogenomics might mean for your health. And there's a big initiative in Europe to get people genotyped and to make the information portable so that it can be transferred between different providers. So they have what's called the PGX passport, and each person gets a gene card that has a QR code, this kind of barcode that you see here, that can be scanned by different providers so they can use PGX information to guide therapy. So this is on the screen an example of a gene card, and it has, if you can kind of see here on the right side, it has the genes listed where a variant was detected, and then it also lists the other genes that were tested, but no actionable variant was found. So that's kind of the advanced strategy, is to know your genes. The next strategy is to keep a health journal. There are many advantages to keeping a journal. So you can uncover lifestyle patterns. Keeping track of everyday health information like diet and sleep might help you consider certain causes and effects that you never thought about before. For example, you might notice that you don't sleep well without a magnesium salt bath before bed, or that your skin rashes seem to clear up when you drink more water. You can also customize your health journal to track progress for different issues that you want to monitor. If you have high blood pressure, you might track your blood pressure every day. If you have diabetes, you can track your blood sugar. Although a lot of glucose monitors have the ability to automatically track blood glucose for you. There are even apps that let you take an EKG at home to monitor your heart rhythm. So that's a newer technology that might be helpful to you if you have any sort of cardiac condition or issues with your heart. If you have pain, you can keep track of your daily pain, and this can kind of help you identify factors that improve or worsen your pain. There are also a lot of different templates to track mood, and that's something you can include in a health journal to see if your medications are working or if they are leading to different side effects. So you can kind of customize your own journal depending on what you want to track. I would recommend at least keeping a general symptom diary. So what symptoms you're experiencing, when it occurred, and how long it lasted, the intensity, any triggers or treatment that you used to help with the symptom. And then also report side effects that you experienced to your doctor. And so if you've been keeping this health journal, it'll be really easy when you go into your doctor to say, hey, I've been having these issues, and it's been kind of related to these factors. I've noticed some triggers. So that'll help your doctor manage potential side effects or help understand if it's a new condition that's happening. So if you do have a serious or unexpected side effect, you should consider reporting it to FDA MedWatch. Health professionals, consumers, and patients can voluntarily report observed or suspected adverse events for medical products to FDA. Voluntary reporting can help FDA identify unknown risks for approved medical products. Reporting can be done through the online reporting portal or by downloading and completing and then submitting the form 3500B, which is this kind of one right in the middle of the screen here, that's for consumers and patients. And then submitting that to FDA MedWatch, which is FDA's Safety Information and Adverse Event Reporting Program. Information you should consider reporting to MedWatch could include unexpected side effects or adverse events, anything from skin rashes to more serious complications, product quality problems like information on whether a product isn't working properly or if it has a defect, product use, medication errors that can be prevented. So these can be caused by various issues, including choosing the wrong product because of labels or packaging that look alike or have a similar brand or generic name. So this type of giving this type of feedback to FDA helps them know what types of actions they can take with drug manufacturers. Maybe they can, if they get reports that people are confusing one medication for another because the labels are too similar, they can actually work with the drug company to update the labels. So it can make a big impact if you report things like this. Even with medical devices, mistakes can also cause or be caused by difficulty with a device due to hard to read controls or displays, which may cause you to record a test result that's not correct. Therapeutic failures is another reason to report. These problems can include when a medical product does not seem to work as well when you switch from one generic to another. So that's another big thing. It may be related to a quality issue. So we can get the right med, we can use genetic information and other factors and make sure it's the perfect med for you. But then if there's something wrong with the product itself, it's not going to work or may cause a side effect. So reporting those types of quality and purity issues is really important as well. Strategy number 4 is to take your meds correctly. So as soon as you get that kind of patient information leaflet, when you pick up your prescription, it immediately gives you an opportunity to participate in your own care. This can help you understand diagnosis, treatment, or prognosis with more clarity and can help you make informed decisions. In a short doctor's visit, it's often challenging to get all the information you need to make a decision. An average doctor's visit may be as short as 8 to 10 minutes, which is not much time, for discussion, exam, and management, which are all supposed to be included in the visit. So even if a doctor was able to share all of the information that's necessary, you may not be able to fully take it all in and remember everything. So the patient leaflet is a good resource to help you understand how to take your medication and what to expect. So make sure to read warnings on the label, check the list of ingredients for anything that you may be allergic to. Know the expiration date. A lot of medications start breaking down after the expiration date, so they can be less effective. Some medications don't work as well as if you skip doses. So make sure you know how much to take and how long to take it for. And know which food or beverages to avoid while taking any medicine. You can also ask about side effects. That would be a good thing to ask about and report any that you experience to your doctor and also potentially to MedWatch to let the FDA know. Using the patient information leaflets allows you to increase your knowledge, even if the staff doesn't have time to talk through all of the necessary pieces of information. Studies show that patient awareness of the benefits and side effects of their medication increased after reading leaflets, and they also took their medicines more effectively, which leads to better outcomes. Medication adherence and taking your medicine consistently is another opportunity. So these are some different devices that you can use to help take your medicines correctly. You want to make sure you're taking at the right time. If you're supposed to take it with or without food, that's important. So A few devices include pill boxes, both simple and smart, dose packaging, and advanced technology. So let's kind of talk about some of these. So first is just a simple pill box. And what people do is they take all of their regular medications, take them out of their pill bottles and fold these boxes in each of the right places. These are good to help organize your medications and take them at the right time. A nurse, family member, or friend can fill your pill box for you. You still have to get your refills on time to be able to fill the box and avoid missing doses. It doesn't do anything to remind you to take your medicines, though. There is newer technology called smart pill boxes. These, there are different boxes for times of the day and days of the week. When it's time to take your dose, an alarm sends an alert to you, and the well lights up, and you open up the compartment and take those pills. If you do not take the pills, it can detect that and then can call you to let you know, and can create an adherence report, which can be viewed to see which times of the day and days of the week the meds have and haven't been taken. Your provider can also get involved and talk to you about adherence and how to overcome any issues that you're having taking the meds during the right time. So compared to a simple pill box, this has a lot more to improve and track adherence, and also get family members involved. There's custom dose packaging. So companies like PillPack, it is individually dosed packaged medications on a roll, and you pull off one at a time when it's time to take that particular dose. They're mailed to you. The meds are organized. You do not get any reminders to take them. It does not track adherence, and it doesn't, get your family members involved. And it's kind of a custom pharmacy that prepares these dose packages. And then there's advanced technology. This is an example of a technology on the screen called Medicube. The way it works is you get all of your medications and you pour them into the compartment at the top. Then your regimen is programmed into the machine. When it's time for your next dose, it pops up out of the bottom, and it can detect if you took your medications from that dose. As long as someone can fill the top, the rest works really well. It can remind family members that a dose has not been taken. It can produce an adherence report and get providers involved. Another big advantage of Medicube over other devices is that it can be programmed remotely if you have a change in regimen. So it's more flexible to make changes in doses. So here's kind of the summary of the advantages and disadvantages of the different devices that can be used to help with medication adherence. When it comes to the option to be filled by a pharmacist, this really can't be done by a simple pill box. It can be done with a smart pill box, depending on the design, and dose packaging is filled by a pharmacist. Advanced technology usually is not, but it's less necessary because it's easy to fill. When it comes to the next three features, reminding you to take the medication, detecting non-adherence, and providing an alert and adherence report, really it's only the two smart devices, so smart pill box and advanced technology. When it comes to allowing pharmacies to dispense medications as they normally would in pill bottles, simple pill boxes, yes. Smart pill boxes, only if it's manually filled. This is not true for dose packaging, and it is true for advanced technology. Why does this matter? Well, for a couple of reasons. You may have a lower copay if you have a 90-day supply filled by a pharmacy instead of a 30-day supply. Then there are restrictions on how often the regimen can be changed. It also allows for more flexibility if you can bring your meds from home and place in a pill box versus having to get dose packaging filled by a pharmacy. And then flexibility to make changes in medication regimens between refills. With a simple pill box, it's technically possible, but requires a knowledgeable person to make the changes. So you need to know which pill to take out and replace. For a smart pill box, this is difficult to do. Same with dose packaging. With advanced technology, yes, that's one of the major advantages, is that it can be programmed remotely to make changes between regimens. And then what about how, easy it is to take medications with you? How portable is it? Usually with pill boxes, you can take a 1-day supply. Same with dose packaging. You can also do this with the advanced technology by pre-dispensing a dose. It just requires an extra container. In terms of cost, pill boxes have a minimal cost. Smart pill boxes can cost more. And then, of course, the most expensive is the advanced technology. So the last strategy, and to me, the most important, combined with the medication list, is to ask questions. So I have some examples here of the types of questions that you should ask and know the answers to. So either by getting information from your doctor or pharmacist, or by reading information in the leaflet that comes with your medication. These are some questions you might want to ask. So getting information about your new medication. What is the name of the medicine? Why am I taking this medication? What is the name of the condition this medicine will treat? How long will it take to work? That's a good question. You talk about some of the medications used to treat depression. Those can take 4 to 6 weeks to actually start working, but you can start getting side effects right away. So if you don't know that, you might get the side effects and not want to take the medication, and it wouldn't have had enough time to work. So that's an important question as well. How should I store this medication? Does it need to be refrigerated? Again, if anything happens with the medication itself, it may not work, or there may be side effects. So storing it correctly is really important. Can the pharmacist substitute a cheaper generic form of the medication? So they may want to prescribe you a brand name drug. If it's not covered, that's a good question to ask too. If you can get the generic version, and it could save you a lot of money as well. Will the medicine create conflicts with the other medicines I take? That's asking about drug interaction. So, if I take this medication, will it affect how well another medication works? These are, and a question that you can ask that may even prompt a doctor to think about something they may not have considered before they prescribed it. So it might actually help catch things that may have otherwise been missed. Ask about the right way to take your medicine. When and how often should I take this medicine? Is it as needed? Am I supposed to take it on a schedule at a certain time each day? Do I take the medication before, with, or between meals? How long will I have to take it? We often get prescribed medications, but it's also important to know when we can consider stop taking that medication. Is it okay to eat or drink food before or after I take the medication? If I forget to take it, what should I do? And what should I do when I want to stop taking this medication? So is it safe to just stop? Some medications, if you've been taking them for a while, it's not safe to just kind of stop cold turkey, because you can get kind of rebound symptoms, and it can aggravate the condition that it was used to treat. So depending on what medication it is, you may need to kind of taper it down if you want to stop taking the medication. So that's important information to know. And ask about how you will feel. How will I feel when I start taking this medication? How will I know if the medicine's working? What side effects might I expect? Should I, when is it's serious enough that I should report it? Are there any lab tests to check if the medication's working and the medicine's level in my body, or if there's any harmful side effects? So some medications do require monitoring with certain types of lab tests. So that's an important piece of information to know. And then ask if a new medicine fits in with your other medicines. So are there medicines or activities that I should avoid when taking this medicine? How will this medicine change how my other medications work? And will this medicine change how any of my herbal or dietary supplements work? Again, remembering to identify, if you are taking anything over the counter, because these are all different things that can affect new medications that your doctor may prescribe. So if you've enjoyed today's presentation, you may be interested in some of our upcoming events. I did want to let you all know that National Adverse Drug Event Awareness Day is coming up on March 24th. And a lot of organizations are participating in ASP's Fourth Cause campaign by hosting educational events to raise awareness about adverse drug events. We're also working on some advocacy. And if you go to fourthcause.org/RightAct, you can find out more about legislation to update the National Action Plan for Adverse Drug Event Prevention. And it would also provide funding for pharmacogenomics research. You can also sign on to support the legislation if you're interested by visiting this webpage. And we also have a social media toolkit to make it really easy to share this information on social media and help raise awareness. So I definitely recommend checking out this website. And so thank you for your time today. I hope this information was helpful. And with that, I'm happy to answer any questions.